Good afternoon, everybody. Today we're going to be talking about a serious topic. The topic of conversation today is complex post-traumatic stress disorder. This is a sister diagnosis to PTSD, but they are also inherently different. So I have a lot of experience and knowledge in this area. I've done extensive research, and I also have had conversations and met people who had this diagnosis. Today we're going to be going over the causes and symptoms of the diagnosis, the interpersonal and general effects of CPTSD, and also the treatment options available for those suffering. So the first thing I want to talk about is the causes of CPTSD. According to Catherine Matheson of Psychoanalytic Psychotherapy, CPTSD is caused by exposure to a stressor event, typically of an extreme or prolonged nature, from which escape is difficult or impossible. So the main distinction we're going to see for CPTSD versus post-traumatic stress disorder is that CPTSD is a traumatic event that is prolonged, that is repeated over and over a period of time, where escape is essentially impossible. Some examples of this are going to include concentration camps, slavery, kidnapping, torture, as well as prolonged childhood sexual, physical, or emotional abuse. Also, I'm going to talk about that CPTSD has 3 additional symptoms to that of the PTSD diagnosis. What we're going to see for PTSD is sense of threat, avoidance, and re-experiencing of the trauma. We're going to see these same things for chronic post-traumatic or complex post-traumatic stress, but we're also going to see interpersonal disturbances, which is problems being able to have relationships and in your personal life, negative self-concept, extremely low self-esteem and self-concept, obviously, and then affect dysregulation, which is extreme difficulty being able to control your mood. So the next thing I would like to talk about today is how CPTSD impacts interpersonal affairs. It is really difficult for people with this diagnosis to make and keep relationships, as shame, guilt, and isolation are a major part of this diagnosis. CPTSD also goes a little bit deeper than PTSD. They're both very serious, but CPTSD, people with that diagnosis are more likely to have personality and dissociation disorders, which make it really difficult for them to make relationships. Also, it's a psychological injury. So the parts of your brain that control making decisions, that part actually shrinks, and the part of your brain that's in control of your flight or fight response actually increases, so you're more hypervigilant. According to Medical News Today, dissociation and symptom experienced by those with CPTSD refers to, quote, feeling detached from emotions or sensations. Some people completely forget the trauma altogether. And lastly, I'm going to talk about treatment options. So the main one we're going to see for complex post-traumatic stress is EMDR, which is eye movement desensitization and reprocessing therapy. What this therapy does is uses bilateral stimulation and movements, and it incorporates eye movements. The objective goal of this therapy, according to the American Psychological Association, is to, quote, change the way that the memory is stored in the brain, reducing and eliminating the problematic symptoms. And lastly, we're going to talk about cognitive behavioral therapy as a treatment option. The goal of CBT is to challenge cognitive distortions and provide coping strategies. In fact, there was a study done where a patient was conducted, had 24 CBT sessions, and Cognitive Behavior Therapist Volume 12 says that quote, the participant reported significant improvements in terms of reduced frequency and distress of dissociation. So overall, CPTSD is very different from PTSD. However, they also have inherent similarities. PTSD is caused by prolonged exposure to traumatic events. It has interpersonal effects and its own treatment methods. I just want to reiterate that it's a psychological injury. As much as it is considered a disorder, it is an injury to the brain. But what I want to leave with you today is that there is 100% hope and treatment available for survivors. Thank you very much.